हेलो, गुड इवनिंग। कैसे हो सब लोग? हाउ वाज द एग्जाम? एम आई ऑडिबल? कम ऑन गाइस, if I'm audible, give me a thumbs up in the chat. Say something, I'm waiting for you. And then we will start the NEET PG recall 2023 for ENT questions. I'm very own ENT faculty, Dr. Sarvejeet Singh, and I'm here to discuss the ENT questions. So, am I audible? Yes? All right, so let us start with the questions of ENT. I'll just go forward. Good evening everyone. Good evening, Manna. So let's start with the first question. Okay, so these are the recall questions. As everyone has been telling you that most of these questions may not be the exact, but they have been not taken for the students like you. And we have tried to put as much exact language as possible over here. And thank you, Manna. Thank you for a comment. So we'll start with the first question over here. So exact question, exact images. I came to know that this image was a clinical image question, and exact is not possible, but near to exact we have taken over here. So let's look at this first question, and I want you to, yes, Nisar, trauma history with something developing in frontal sinus. So I'll come to that question, and that question is in my list over here. So let's first look at this question. A patient presented with progressive growing swelling for last 2 years. On examination, you see the swelling history was mentioned, examination was mentioned. It was dense, mobile and nodular as shown below. What is the most likely diagnosis? Right? Hi everyone. Hi Brace. Hi Nisar. So mucocele and GNA option. So not in this question, they were in different question. That question I will come to, Nisar. I have that question with me. Let's look at this question first. So, it is a pre-auricular swelling. So it was a tricky question. It was a pre-auricular swelling. I am still looking for a straightforward question. You see, dense, mobile. Mobile is something, in a pleomorphic adenoma, we don't get mobile, but nodular is there. So, pleomorphic adenoma, parotid tumor. Yes, everyone is telling me, sir, it was parotid tumor. We have marked parotid tumor. That is when everyone is telling me. So I have kept this controversial question as the straightforward question. So Harshit, yes, everyone is saying that this is the answer over here. And I don't want to disappoint you in the very first question, but the questions that were asked today were clinical. As you can see over here, they were clinical. They were tricky. So they were tricky. And people know that many of the students, they have not been going to their clinical postings due to COVID and even after COVID. So now they are putting questions which are directly based upon history and examination, something that you get to learn more in the clinic than in the theory. Okay, right? So that is absolutely true. And okay, am I visible? Am I visible? I think the feed has gone. Something else is coming up. What I can see from the feed, something else is coming up in my feed, in the YouTube feed. So please tell me if I am visible over there. Can the team check over here? Can something else is coming up in my YouTube feed over here? Okay, right. So, all right. So if I am visible, yes. All right, good. Then we are good to go. All right. So yes, so everyone is telling me, but a parotid swelling, a parotid tumor cannot be mobile. You see, the nodular, the dense is all right. So everyone is saying that, sir, it is a parotid tumor, but I am not that, convinced that it has to be a parotid tumor. I'm still looking for an image over here. If this kind of an image was there, somebody has told me that this was a similar image. The finger was not there. Rest everything was there over there. Then it could be something else. I'm still waiting for a history over here. If something else was mentioned in the history over here. Okay. So then it cannot be a jaw tumor. Jaw tumor again has to be fixed. Right? A parotid gland tumor. Parotid gland tumor is not that mobile. So what we are left, can it be sebaceous cyst? Yes, that is also a possibility. Okay, it cannot be dermoid cyst also. And Nisar, not elevate to jaw after trauma. Yes, that is another question. We'll come to it. All right, that question will come to it. So I am not saying it is a parotid tumor because of the word mobile over there. Okay, parotid tumor is not that mobile. It can be a sebaceous cyst, that can be dense, but nodular. Nodular is something that goes in favor of parotid tumor. Okay, so pleomorphic adenoma Pleomorphic adenoma can be nodular. So yes, many of you can be right. If there is something else that has to be said in this, that was said in this question, that further they marketed or this question correctly, or there was a similar image, you can just write to me. So mobile nodular with varying consistency. Very good. So very good, Rudransh, varying consistency though. So this was also mentioned the question over here. Okay, fluid filled words was used in the question. So if fluid filled words was used in the question, then it goes in favor of sebaceous cyst. If varying consistency was mentioned, then it goes in favor of parotid gland tumor. Right? Okay, so this was the first question. Yes, I have kept the most controversial question as the first question so that I can take the maximum feedback from you. And then the next question. Now this was a straightforward question. A 5-year-old child presented with fever and difficulty in swallowing and pain radiating to ear. He was diagnosed as a case of acute tonsillitis. So this was mentioned to you. Okay, which of the following nerve is responsible for referred pain to the ear? So okay, so referred pain to the ear in a case of acute tonsillitis, this we have discussed lot of time in my lectures. It is glossopharyngeal nerve, tympanic branch of glossopharyngeal nerve. Okay, so that takes the pain to the ear. Referred pain, we have discussed this in case of acute tonsillitis, in case of quinsy, in post-tonsillectomy, glossopharyngeal ninth nerve is responsible for it. So multiple times we have discussed, straightforward question. All right, so that was the answer to this question. Let's go to the next question over here. A 4-year-old child presented with cough, fever, stridor for last few days. So any questions you find that, sir, no, the language was little different, the options were little different. So I have had a lot of students who had given this paper and come and discuss with me. But still, if you find something is missing, please tell me, right? Okay, so 4-year-old child presented with fever, cough, stridor for last few days. Which of the following condition presents with this sign? So the X-ray was given over here, and we can see over here that in this X-ray, there is narrowing of X-ray over here. So this is a steeple sign, and this is seen in case of acute laryngotracheobronchitis, LTB, okay, also known as croup. This is also known as croup. So acute laryngotracheobronchitis, also known as croup. Right? So that is the answer in this question. Right? That's a straightforward question, very tricky question because they have placed acute laryngopharyngitis. So anyone who gets confused can mark that also as the answer. So the answer was acute laryngotracheobronchitis. Yes, Nisar, one question on ET opening and fossa of Rosenmuller was also there. So that we will come and discuss. So this question, yes, it was right. Okay. So let's go to the next question. So yes, this question was there in the exam. A 40-year-old patient presented with progressive loss of voice, dysphagia, breathing difficulty. So 40 years. I don't know whether smoking or alcohol was also mentioned over here. Okay, so whether the patient was a smoker or alcoholic, generally tend to mention that. So I am not sure whether that was mentioned or not. Right? Okay, but this image was given over here. With progressive loss of voice, dysphagia, breathing difficulty has gone through an operation. Identify what procedure has been done. Right? Okay. So you see over here. So same image was there. Thanks, Nisar, for confirming it. So you see what we can see over here. This is a tracheostomy. This is a permanent tracheostome. What else can you see? Look carefully. You can see an incision over here. Okay. You can see this incision over here, which has been given. Okay. So you can see this incision over here. Now this incision demarcates that this is a patient of post-laryngectomy. Which laryngectomy? Total laryngectomy. Right? Post-total laryngectomy patient, and the laryngectomy has been done. This is a permanent tracheostome. Right? No, this is not percutaneous tracheostomy, dear. Rudransh, I'm sorry to say this is not permanent tracheostomy, because permanent tracheostomy, you will see the tracheostomy. What you see over here, the image that I have taken, it may not be the same image, because some of the students, they told me the image also had rings visible over there. But in my case, the image that I have over here, we can see the TEP, tracheoesophageal voice prosthesis. So TEP is visible in this image over here. Okay, it's not the same image, right? But if this image was there, TEP is being seen over there, that's a case of total laryngectomy. right? If the tip is not visible, the rings are visible, again the trachea has been stitched. Okay, and when do we do that? When the total laryngectomy has been done. All right, so this was a case of total laryngectomy. Anyways, look at the history. The history is leading us towards, come on, the history is leading us towards CA larynx. Okay, carcinoma larynx. All right, so clean image, clean opening in front of the image, right? I have this image. I think this was the image that was actually there, right? I have placed this image also. So same question, I have placed two different images. I think some students told me the image was like this. And if this image was there, then you can see that the clear opening is shown over here, right? Okay, and what else you can see? You can again see the incision line over here, coming over here and joining over here, right? It was a planned surgery. So planned operation. Tracheostomy, if there is a stridor. Tracheostomy, if there is a stridor. Okay, tracheostomy, if there is a stridor, it is an emergency surgery. Okay, not much stridor, it can be a planned surgery. But over here, we don't see the tracheostomy tube. There is no tube over here, right? Okay, there is no tube over here. So if there is a percutaneous tracheostomy or a standard tracheostomy, the tube should be visible. There is no tube over here, dear friends. So that cannot be your answer. Permanent tracheostomy is visible. So answer was, this is a case of CA larynx. Okay, underwent total laryngectomy and permanent tracheostome creation. Okay, right. Next question over here, question number 5. And as I always say, any paper of ENT is incomplete without a tuning for question. So you see a tuning for question has come to you over here, right? A 35-year-old female came with Rinne's test negative at 256 and 512 Hz and Rinne's positive for 1024 Hz tuning fork. How much will be the air-bone gap in this patient, right? So I guess this was the question that was asked in the exam. And so we have discussed this in my lectures. So we know that the Rinne's test, you see the Rinne's test, we can do with 3 tuning forks, 256, 512 and 1024, right? And if 256 is negative, 512 and 1024 are positive, so the AB gap or the conductive hearing loss, the AB gap or the conductive hearing loss, okay, it is around 20 to 30 decibels. How much? 20 to 30 decibels. Now, if it is negative with 256 and 512 and still positive with 1024, now the AB gap is 30 to 45 decibels. Right? And if all the 3 tuning forks are negative, then it is more than 45 decibels. Right? So what was the question over here? The question over here clearly said that the Rinne's is positive for, yes, it is positive for, come on, it is positive for 1024 tuning fork, and the remaining 256 and 512, it is negative. Right? Okay, so that means this was the scenario over here, right? So the answer is B choice, 30 to 45 decibels. Come on guys, keep on writing so that I can see what all you are writing over here in this chat. Come on, I'm waiting for your thumbs up. Is the question there? If you are able to get it, what I'm writing over here. Okay, let's do the next question over here. Identify the marked structure in the image given below. Right? Okay, so same question. Thank you, Adarsh. Thank you, Rudransh. So yes, identify the marked structure in the image given below. So this image was given over there. So what can we see over here? This is the image of nasopharynx. Endoscopic image. I have explained this image in detail in my lecture. Okay, so endoscopic image. Okay, so you all marked B. So most of you marked B. Now there is a little bit of controversy in this question. Generally, whenever we give this question, we always ask for fossa of Rosenmuller. Okay, so that is generally asked. Now, some people were confused whether it is eustachian tube opening or it is fossa of Rosenmuller. So this question was asked, if I have to mark, I will also mark fossa of Rosenmuller. Okay, why? You see, eustachian tube opening is over here. It's over here. Now, this over here, this is torus tubarius. This bulge over here, that is your torus tubarius. Right? Okay. Above that, what you can see over here, now this part has to be fossa of Rosenmuller. Right? Right, Adarsh? So, fossa of Rosenmuller will be my answer over here. Okay. Palatine tonsils are deep down into the oropharynx. We are right now looking at the nasopharynx, so it cannot be palatine tonsils, right? Okay, eustachian tube opening. The mark was below. Okay, even if the mark is below, right? So, I'll put the mark over here. Even if the mark is over here. So, Chetu, Chaitanya. So, if the mark is over here, still it is fossa of Rosenmuller. So, the fossa of Rosenmuller is over here, posterior superior, this area which I am now marking. This is fossa of Rosenmuller. If you have to say eustachian tube opening, then the mark has to come a little anterior over here. Okay, so if this is your mark over here, then it is eustachian tube opening, which is not visible in this photograph. If the mark was somewhere over here only, right? If the mark was somewhere over here only, then it has to be a case of fossa of Rosenmuller. Now, it has been a rule in the nasopharyngeal endoscopic photograph. Anyways, they have been asking only about fossa of Rosenmuller. But God forbid, if they listen to this video, next time they can change the ocean. And there was space like in pig. Okay. So if there was space, then, you can easily identify whether it was fossa of Rosenmuller or eustachian tube opening. I go with the fossa of Rosenmuller in this pig as per the photograph and the reviews that I have received. Right? Okay. Let's go to the next question over here. So I also received some different alternate photographs. So somebody said a similar photograph over here was there, but that was the best photograph. You see, I have kept different photographs for you to see, so that you can, you can see that. So image was zoomed more than this. I know. So, I have kept other photographs as well. So somebody said, sir, this kind of image was there. You see, if this kind of image was there, then you can see the eustachian tube opening. You can see the, so pichli wali image same thi, sir. So I know that is the best image that I have shown. Okay. So I just wanted a description and so that you are able to understand what I am trying to say, that this is the fossa of Rosenmuller. So fossa of Rosenmuller is from here to here. Right? This is the eustachian tube opening. So you have to come anterior. Okay. This is the torus tubarius. I hope I am not clear. Okay. So some food particle was also seen. Some secretions were also seen. So not just the food particles. So some people said that some secretions were also seen over here. Right? So, so now you can demarcate the fossa of Rosenmuller, the FOR over here. This is the eustachian tube, and in between I have marked over here, that is torus tubarius. Okay, so I am using multiple colors so that you can identify and differentiate between them. Yes? Okay, similarly, this another image is there, but anyways, so with this image you are able to identify it. Let's go to the next question. So this was the question over here. I think the radiology sir has also discussed this question. And I'll tell you the difference between what he is saying and what I am saying. So, if a 30-year-old male presented with proptosis of eye, he has a history of road traffic accident 15 years back. Following is the CT scan. What is the most likely diagnosis in this patient? Okay, so the first look of this CT scan. So, if this was the CT scan, then what we get was frontal mucocele. Okay, let me change the color. Yeah, so what we get is frontal mucocele. Right, so it was going into JNA. No, it cannot be JNA, dear. It cannot be JNA. This is not the history of JNA. Whenever there is a JNA history, so JNA history, what is there? Teen, male, epistaxis. Okay, three classical criteria. So 30 year cannot be JNA. Ruled out. Ruled out. Okay, JNA is ruled out. History of road traffic accident. No history of epistaxis. JNA is ruled out. Okay, so no angiofibroma. Angiofibroma, we cannot say this is angiofibroma. That is ruled out. Okay. Now, there was a breach. Yes, I agree, Rudransh, there was a breach seen in the CT scan. So, okay, there was a breach seen in the CT scan. It can be a frontal mucocele. That's what everyone is saying to me. I am not convinced. Let me say no. Why? Because I just talked to the radiology faculty. So, they said, sir, some air was also seen. So, in the X-ray that, in the CT scan that he has received, some air was also seen. Okay, so he said it can be an encephalocele. There can be a air. There is air. So something like that. But if this was the CT scan, then it has to be a frontal mucocele. Okay, so if the breach is there, no, pseudotumor orbit will look totally differently. That cannot be a diagnosis looking at it. All right, no air. So Rudransh says no air. He wants the answer to be mucocele, right? I know. I think you have marked mucocele. Okay. So homogeneous mass was there. So homogeneous mass means it will be a mucocele, right? Right, that I agree. Adarsh, I'm totally agreeing to that. Okay. So if this is the image, let's go with the answer that is the frontal mucocele. Right? Okay. Let's go to the next question, and then you write down these questions. You just let me know if there is some modification required over here or some image that you want to improve. Right? Let's go to the next question over here. Which of the following is not an indication for the given instrument? Okay, so what do you see over here? What is this? This is a tracheostomy tube. This is a tracheostomy tube. Now, first of all, many students, they came and they told me, sir, we think it was a eustachian tube. No. Okay, so same question, Adarsh. Good, thank you. Okay, so same image. Was the image same? Was the image similar? Okay, so tracheostomy tube or a eustachian tube. So I discussed with different students. They are saying it's a case of tracheostomy tube. Upper airway assessment. Same image. Chetu, very good. Thank you, Chaitanya. So upper. Same image, Nisar. Okay. So upper airway obstruction, yes, we use in case of upper airway obstruction. We use in case of clearing out the secretion. So pulmonary toileting. Upper airway assessment. No, we don't use it for assessment. Not an indication. Right? So not an indication. Yeah, Adarsh, I heard today a lot of images. Image quality was very bad. Some images were even big. So you had to scroll down to look at the images. In one of the images, the answer was given at the bottom. I heard that in orthopedics. So that was good. They gave the answer in the question. That was what I heard. That they did, despite all the scrutiny, they did mistake. So it was not a 200 question paper. This was 199 question paper. One question was for your presence of mind. If you can see the question, you know the answer. You have to look at it carefully. One was given to you. Mouse bhi nahi chal raha tha. So these kind of problem will always happen. Don't worry. Right? So mechanical ventilation. Yes, we use it for mechanical ventilation. So if that was an option, that is also the indication for tracheostomy. Now the question over here is, which of the following is not an indication? So you see, this is not an indication. So therefore, you see over here that your answer becomes over here upper airway assessment. We never use tracheostomy tube for assessment, right? So that becomes your answer over here, right? So answer is upper airway assessment. The remaining three are indication. Okay, thank you, Abhishek. ENT questions all correct up tak. Very good. PYQ discussion. Obviously, when I say PYQ, I actually mean PYTs. The topics have to be discussed. You have seen that. You are likely to mark all the answers correct. A student is yawning. Let's look at this question. A student is yawning in the afternoon. So Nisar was saying that this question was asked in the exam. Student is yawning in the afternoon class and got stuck with open mouth. Which of the following muscles is attached to the articular disc of mandible? Right? So this question was there. Okay, so Mukesh is asking what cutoff will be according to paper. So TMJ, temporomandibular joint, TMJ was used in the question. So TMJ, okay, so got stuck with the open mouth or temporomandibular joint, somewhere like that. TMJ was given in the question. Okay, agreed, that we have taken over here, right? So what is the answer to this question? Come on, guys. Come on, everyone. Yes. So answer to this question has to be lateral pterygoid muscle. Okay, on the muscle articular disc. Okay, look at this question over here. So what is attached to the articular disc over here? You can see it is the lateral pterygoid muscle. Right? So you can look in this photograph, the lateral pterygoid muscle. Okay. Yes, Adarsh, lateral pterygoid muscle. So that is attached to the articular disc over here. Right? Okay. So let's come to the next question over here. So that was actually the question started in ENT, but it was not an ENT question. It was an anatomy question. So it starts in ENT and it goes to anatomy. That's how the paper will be now. That's how everything will be, right? It will be an integrated question. It starts in ENT or it starts in something else. They're trying to give you a flavor of, the next exam, because this is an integrated question. So if an ENT question paper comes to you, which will be 60 question paper, now 10% will be anatomy, so they can ask directly anatomy question. The remaining will be integrated. So they will start in ENT and they will go to anatomy or maybe microbiology or maybe pathology or pharmacology. So something like that, right? So patient presented with, okay, so Rudrash is saying deep cervical fascia is one of the options over here. Presented with progressive swelling below the ear lobule, which has now caused severe pain for some time. So severe pain is there for last some time, some months or something like that was mentioned. Which of the following structure is responsible for pain in this patient? So you see the swelling is below the ear lobule, right? So let's understand. So facial nerve goes forward. Okay, what comes out of the stylomastoid foramen? What comes out of stylomastoid foramen? So basically, now we have extratemporal segment of facial nerve. Okay, so extratemporal segment of facial nerve, this is mainly a motor nerve. This is mainly a motor nerve. So it will not cause pain. It will cause palsy of the facial muscle. So patient will have facial palsy if this nerve gets compressed. Now over here, the patient is complaining of severe pain. So what other muscle is nerves are there over here? You see the auriculotemporal nerve is coming anterior over here. Okay, it is going anteriorly over here. So that option is again ruled out. Greater auricular nerve is coming from below. Okay, C2, C3, and this can be a cause of severe pain. Right? So severe pain radiating to the ear. So answer has to be greater auricular nerve. I hope most of you have marked this as the answer. Greater auricular nerve. Greater auricular nerve. Yes. Yes, Adarsh. Okay. So Mukesh also says yes. Good. Very good. Proud of you guys. Right? Okay. So these were the questions. There is one more question. Actually, it's not my question. It will go to dermatology or medicine. So a lot of people are going to claim. So yes, but I'm discussing this question over here. Right? So 48-year-old HIV patient presented with multiple masses in palate. While examining the mouth, following was seen as shown in the image. So Kaposi sarcoma, you see over here, classical presentation. This is the classical photograph over here, right? So yes, the same image was there. So Kaposi, everybody is marking and saying Kaposi. I know because this is a classical image that is being seen and shown in the various lectures. So as I said, this question will be claimed by a lot of faculties because it's a, it's from oral cavity, but it's a overlapping question, overlapping topic with a lot of faculties. So medicine people will also teach you, dermatology people will also teach you. Yes, Nisar is showing his biceps. So that's good. It's a FMG repeat. Yes, so these questions, I always say that FMG and NEET PG, they are both being prepared by the same board. So obviously the questions are repeated from one exam to another exam, right? So these were the ENT questions that I have gathered till now and they have been asked. And if you want me to improve these questions, you can just write to me at Dr. Sarvejeet Singh at Allen Okay, that's my official email ID, and you can just write to me whatever you want me to improve over there. I'll be happy to improve you. Thank you, everyone. And then we'll be coming live. Another faculty is coming live, and we'll be discussing the questions. So don't go away. Be over here, and then we'll discuss all the remaining questions also with you. So the plan is to discuss all the questions one by one, all the subjects, and someone is again coming up. So stay back over here and don't go, and do write to me. Yeah, so now I'm at Ellen Nisar, and I'll be here for a very, very long time. So let us be positive, and I think we'll be giving you the best things over here. So yes. Okay. So don't worry about it. Right. So let us